Blood in your stool, a change in bowel habits, fatigue, stomach aches. No matter what your age, don't ignore these symptoms. Our next guest, as she discovered, they could be a sign of a very serious medical issue.
My name is Shannon, and when I was 23, I went to see my OBGYN. I had stomach aches and was dealing with fatigue and seeing blood in my stool. I was eating very poorly, and she told me that it was diet and stress. So I changed my diet, I saw improvements, and I thought, problem solved. The symptoms never really went away, I just got used to them. 2 years ago, I went to see my primary care physician, and telling her my symptoms, she got greatly concerned and told me that I needed to have a colonoscopy. I was really reluctant to do it, but my husband convinced me. The following day, I got the phone call that I had stage 4 colorectal cancer. Sorry. Yeah, I'll never forget that moment. They ended up removing 2 feet of my colon, 6 months of chemo, and then daily radiation. Living with this is a challenge, but I have amazing family and friends. I am here to fight this cancer.
Shannon is joining us today. I want to thank you so much for sharing your story with us here today. Also joining us is Dr. Freda Lewis-Hall, the Chief Medical Officer of Pfizer, who's back to help raise awareness about colorectal cancer. And Shannon, you were 23 when you told your doctor that you had blood in your stool. Mm-hmm. How old were you when you actually got diagnosed with colorectal cancer?
I was 31. It was 2 weeks before my 32nd birthday.
Doc, talk about how this cancer affects the body.
Colorectal cancer can start with abnormal cell growth and inflammation in the colorectal tissue, but most start as growths or polyps in the innermost lining of the colon or of the rectum. Mm-hmm. Now, the good news is fewer than 1 in 10 polyps turn into cancer. And the even better news is that of those polyps that do have abnormal cell growth, they can still, at early stages, be removed surgically before they become invasive cancers.
But if those cancer cells continue to grow, it can then spread to other organs like the lungs, liver, or stomach. Let's talk about some of the symptoms when it comes to colorectal cancer.
You want to look for changes in bowel habits, such as diarrhea, constipation, the narrowing of stool that lasts for more than just a few days, and also the feeling that you have to have a bowel movement that isn't relieved after you've actually had a bowel movement. Now, there are other things that should concern you. Rectal bleeding, dark stools, weakness and fatigue, unintended weight loss, pain and abdominal cramping, which, Shannon, you had noticed as one of your warning signs. Mm-hmm.
Family history or personal history of polyps does play a role, and I want to ask you that. Do you have a family history of colorectal cancer?
I do, but I unfortunately did not know my medical history prior to my diagnosis, so I didn't know to look out for certain things as far as family medical history goes.
So if you have type 2 diabetes, ulcerative colitis, or Crohn's disease, all of these things may also increase your risk for developing colorectal cancer. And race is another risk factor. African Americans have the highest colorectal cancer incidence and mortality rate in the U.S. Now, we're not exactly sure, unfortunately, what the reasons are for this.
Lifestyle-related factors have also been linked to colorectal cancer, things like smoking, certainly heavy alcohol use, obesity, lack of physical activity, as well as a diet high in red and processed meats. What advice, through everything you've been through, would you want to pass along?
Early detection. A lot of times we are told or made to think that you should think about these things later on, but I was 31, so early detection is important.
And knowing your body, you're here raising awareness, which is so important. How are you doing?
My cancer, unfortunately, has metastasized to my liver, so I am currently still undergoing treatment. I actually have chemo tomorrow, and just living my life to the fullest. I also started a nonprofit organization called Brown Sugar Rehab, which raises awareness about colon cancer and the symptoms and the risk factors and how important it is for early detection.
This is particularly important because there's a recent study that found that colorectal cancer is increasing in young adults. Mm-hmm. And even if you don't have symptoms or if you don't have risk factors, it's recommended that you start colon cancer screening beginning at the age of 50.
And I just must add, as I'm sure you will as well to this, what an inspiration and remarkable young woman you are for everything you've been through. And yet through it all, to continue to raise awareness, which is obviously what you're able to help us do here today on the stage.
And hopefully what we've talked about today will increase the questions that people have. If they want more information, we've put information about colon cancer and screening on gethealthystayhealthy.com. And while they're there, they can sign up for our monthly newsletters.
Perfect.
So thank you again.
Thank
We're
you.
wishing you all the best, Shannon, moving forward. More to come, everyone.